Access to Democracy is made possible by donations from the following organizations. Thomson Reuters, a global company with expertise and insight to unravel complex situations in the areas of law, tax, compliance, government, and media. Their worldwide network of journalists and editors keep customers up to speed on relevant global events. Crutchfield Dermatology, a full-service treatment center and Medi-Spa in Eagan. Their goal is to help you look good and feel great with beautiful skin. With service built around courtesy, dignity, and respect, Mayo-trained Dr. Charles Crutchfield personally treats each patient and is acknowledged as one of the nation's best physicians. Truestone Financial, with locations in Minnesota and Wisconsin, has proudly served its members since 1939. Truestone engages, educates, and supports its members to ensure they have the tools to empower their financial well-being. Truestone Financial, your neighborhood credit union. Learn more at truestone.org. Edina Eye Physicians and Surgeons, a division of Twin Cities Eye Consultants, has proudly served the Twin Cities for more than 55 years now in 7 convenient locations. Using the most advanced technology combined with human touch, Edina Eye offers comprehensive services and dedicated specialists committed to excellence with innovative procedures and expertise for the most advanced eye care.
Welcome to Access to Democracy. I'm Bill Raker, your host for this edition of the program. Thanks for joining us. Our guest is Cathy McLeer, State Director for AARP Minnesota. Welcome to Access to Democracy, Cathy. Delighted to have you.
Thank you, Bill. It's good to be back.
Yes, you are a returning guest. You've been with us before. It's always a delight to have you share your perspective with us on the environment of the elderly people or those over 50 in the AARP realm. We're going to focus on the advocacy work that AARP does on behalf of all citizenry, not just the members of AARP or not just those over 50, but for everyone. But as a little bit of background before we get to that, would you share with us the origin, the history of AARP and why that's so important to what your mission is?
Sure, happy to do that. So AARP is the nation's largest nonprofit, nonpartisan organization really dedicated to empowering people 50 and older to choose how they live as they age. And for more than 60 years, we've been making communities stronger by advocating for what matters most to families. So not just the 50 plus, but for families. And that includes health security, financial security, and personal fulfillment. So making sure that people are able to enjoy life as long as they live, that their health lasts as long as they do, and that their finances last as long as we live.
And that's a really important and beneficial mission. So how big is the organization? What's the national membership and the membership here in Minnesota?
Yeah, so we are a nationwide organization with a presence in all 50 states plus Washington, D.C., the Virgin Islands, and Puerto Rico. So we have state offices, we have staff and volunteers in all of those offices, and we have nearly 38 million members nationwide, including 630,000 right here in Minnesota.
That's quite a presence, both
it is.
At the state level as well as nationally.
It is.
And so what's the requirement for membership in AARP?
So clearly our focus is dedicated to helping people age 50 and older, but our founder, Dr. Ethel Percy Andrus, was a very wise woman, and she said, what we do for all. And so this is probably the best kept secret, that you don't have to be 50 in order to join AARP. In fact, we had a TikTok influencer who, at the keen age of, I'm not sure what, 40 or 38 or 28, realized that you could get great benefits by being an AARP member. Mm-hmm. And so we've actually seen an insurgence of individuals who are younger than 50 who have discovered the benefits of membership. But again, we really focus our effort on those who are 50 and older.
Well, what are a couple of those key benefits that the members are interested in?
Sure. Well, most people join us because they do know about our benefits. And so there are a number of discounts, and we have a number of insurance products. Now, the insurance products, I think you do have to be 50 in order to take advantage of some of those products and services. But the discounts on hotels and car rentals, those kinds of things. We have a great rewards program. You can sync your fitness tracker with the rewards. You can earn rewards by taking taking a quiz or watching a video, and again, syncing your fitness tracker, and there are all kinds of great discounts and benefits and gift cards you can get through the AARP Rewards program.
Well, that's fantastic. Now, we'll be scrolling the AARP website on our screen as we talk. So if people are interested in finding out more about the different benefits and privileges that they get with AARP, they can go to the website and discover those things there.
Absolutely.
Yeah.
But I think, Bill, the most important benefit of being an AARP member is that you have the tremendous power of those 38 million members nationwide. You have staff in every state advocating on behalf of the 50 plus and their families, and that's really the power that AARP has, is that influence.
And that's what we want to focus on with this program. So with the advocacy work that AARP has done and is doing and will continue to do, what were the priorities for 2022 and what was achieved, and then we'll look forward to 2023. Can you share that with us?
Sure. Well, and we can certainly get into the state level things, but I do want to highlight a really important, really monumental piece of legislation that was passed this year that will make a tremendous difference for people, particularly age 65 and older, who are receiving Medicare benefits, the Inflation Reduction Act, and what that has done to bring down the cost of prescription drugs. Of course, we know it's going to take time to implement that, but I've been with AARP for 18 years, and this is an issue that we have been working on since I stepped foot in AARP, and we finally got it across the finish line. This has been decades of work to address the real challenge that people are facing with the high cost of prescription drugs. And so we could not have done that. We could not have gotten that across the finish line without the millions of individuals who made phone calls, sent emails to their members of Congress, sent letters to the editor, really raised this issue talking about how much they were struggling with the high cost of prescription drugs. We know that in America, we spend up to 3 times what people in other countries pay for the same medications, and that's just not right. And so this was a huge victory. It's going to do a lot to bring down the cost of prescription drugs within the Medicare program. It's going to save money for not only beneficiaries, it's going to save money for Medicare, and we hope ultimately it will bring down the cost of prescription drugs for everyone.
Could you note just a couple of specific things that bill accomplished?
Yeah, I'm happy to, and I'm going to refer to my notes just so I don't, so I don't get it wrong, because there are a number of key dates involved as well. So, starting this year in 2022, drug companies will have to pay penalties for increasing the cost of their drugs higher than the rate of inflation. So we know inflation is very high, so right now that probably doesn't help us a whole lot, but for drug companies who do that, when they increase the cost of their drugs faster than the rate of inflation, they will have to pay a penalty. So that's starting this year in 2022. In 2023, and this is a really big one, for Medicare beneficiaries, common vaccines will be free. So, for example, the shingles vaccine, I think the list price is around $350. And so for Medicare beneficiaries to not have to pay for those preventive vaccines, it will really help protect them from very serious illness, and it will help save some dollars out of their out-of-pocket costs.
Very significant, yes.
That's very significant. The other big one that starts next year in 2023, co-pays for a 30-day supply of insulin will be capped at $35. We know that this has been huge. The cost of insulin has increased dramatically over the last decade. And that will be a huge cost savings for individual, diabetics who rely on insulin. And in 2025, out-of-pocket costs for Medicare beneficiaries in Part D will be capped at $2,000. And so you've heard about the donut hole where, you do your cost sharing and then you hit this hole where you have to pay the full cost of all your medications until you hit catastrophic coverage. Well, starting in 2025, those out-of-pocket costs will be capped at $2,000. And then this is really the big one. Starting in 2026, Medicare will finally be able to negotiate for better drug prices. Right. Prior to the passage of this act, Medicare was banned from negotiating with drug companies to get better prices. And we know that this has had bipartisan support across the board. Voters, Republican voters, Democratic voters, independent voters across the board, 80% approval of this concept of having Medicare negotiate for better drug prices. And so starting in 2026, That will start happening. It'll be a limited number of drugs to start with, and more drugs will be added all the time. It'll be, kind of on those top, most expensive drugs. But this is such a critical provision that's going to save Medicare billions of dollars. It's going to save, individuals money in the long run. And it's something that AARP has been fighting for decades. And so it's really, really monumental to have that across the finish line.
That's the right word to describe what has occurred with the passage of this bill. And certainly with the advocacy work that AARP did with its resources and with its volunteers, must have been a huge influence on getting the legislators to enact that bill.
It was. I just can't say enough and thank everyone who took the time to share their personal stories on how the high cost of prescription drugs was impacting them. We hear all the time from our members how much they're struggling to either keep food on the table, pay their rent, pay their heat or electrical bill, because they're having to choose between the cost of paying for these sometimes life-saving medications, or paying for those essentials, and it has been such a struggle. And so we hear all the time how much of an issue this is, and we're just so pleased. Again, it shows the power that individuals have, because they can call their legislators, they can write letters, they can send emails, and this would not have gotten across the finish line without folks putting that pressure on lawmakers to get it done.
Well, we thank you very much.
Well, we thank everyone who took action.
So that's one priority that AARP has been focused on for a number of years, the control of prescription drugs. Mm-hmm. What's another priority that is on the AARP list?
Sure. Well, certainly protecting the guaranteed benefits of Social Security and Medicare going forward. We know that this is such a tremendous safety net for retirees who rely on that benefit. The good news is, the cost of everything is going up, right? That's not good news. That's bad news for everyone. And people are really feeling it in their pocketbooks, particularly individuals who rely on Social Security as either half their income. We know 37% of Minnesotans age 65 and older rely on Social Security as at least 50% of their income. And as many as a quarter of Minnesotans who receive Social Security benefits rely on it for 90% of their income. So when you look at that and you realize that monthly Social Security check is roughly $1,600, and you see the cost of inflation going up and up and up, and groceries are going up and gas is going up, that really hits people hard, right? The cost of living adjustment within Social Security is tied to the rate of inflation, and so Social Security recipients in January will see the biggest increase to their checks in 40 years. So that monthly check will go up by roughly $140. Mm-hmm. Okay. So that's a pretty important thing. But we also know that we have to work very hard to protect those benefits for current recipients and for future recipients. We know, everyone pays into Social Security. This is an earned benefit. And so as we move into 2023 and of course into 2024, this is going to be a critically important effort on AARP's behalf to make sure that we secure those programs and keep them solvent.
We sometimes often hear, in fact, people talking about, maybe Social Security should be privatized, or maybe we shouldn't have Social Security because it's going to run out of funds, or we raise the retirement age, raise the contribution limits. With those kinds of discussions in the background, it's really critical that we stay focused on keeping the benefits that we have and making sure that as they move forward, that they stay, consistent with what the needs of the recipients of Social Security are.
Yeah, absolutely. And I think it's really important also to point out, Bill, that in its since it was established in I think it was the 30s, because we're on. I can't do public math very well, but since its inception, Social Security has never missed a payment. And I know there's a lot of concern over the solvency of Social Security. Lots of people will claim that Social Security is going broke. It's not going broke. It is fine until 2035, and if nothing is done at that point, yes, there will have to be a reduction in benefits. And so some difficult choices will have to be made on how we shore up that program going forward. But it is on sound, secure footing, at least until 2035. At that point, if nothing is done, benefits will be reduced to it'll be able to pay about 75% of the current benefits. But better to not kick the can and wait until that very last moment. And so we will be working very much in earnest to make sure that those solutions are found and that we keep it on good, solid footing.
So with constant attention on it and the appropriate actions on the part of legislators who will be responsible for this, the program is sustainable.
It is sustainable.
And that is a priority that AARP has.
Absolutely.
Great.
Absolutely.
So what are some other priorities in the advocacy field that AARP is working on?
Sure. Well, we can start maybe with some of the accomplishments that we did get done in 2022.
Yes, let's celebrate those.
Yeah, let's celebrate what we did get done, right? Because there's a lot of work that didn't get done. So, of course, hero pay. Coming out of the pandemic, those frontline workers who...
And we're talking about Minnesota
yes,
right now.
Yep,
yes,
now we're
yeah.
back to Minnesota,
Right.
Minnesota policies. So, those folks who were on the front lines doing healthcare, working in grocery stores, who had to show up every day, because folks like myself, I was able to work remotely, but those essential workers didn't have a choice. They had to go to work. And so passing hero pay for those individuals was a really important thing to get done, because we know a lot of long-term care workers who were taking care of our seniors in nursing homes or assisted living facilities, were in that position. So hero pay, that was great. Funding to expand affordable, reliable, high-speed internet. We know during the pandemic, that the internet was a lifeline to so many people. You heard about the Zoom Christmases and Zoom birthdays and holidays where, folks didn't have access to the internet. They just didn't have a way to stay socially connected to their families and friends. And so we did get some expansion to Minnesota's Border-to-Border grant program that does expand that infrastructure to make sure that there is access and affordable high-speed internet to individuals, particularly in some of those underserved parts of the state, in our rural areas.
Well, it's really interesting to hear that AARP had the extension or expansion of broadband access as one of its priorities. Wouldn't necessarily think that would fit into the mission, but it does, because it's all about keeping people connected and informed and access to the information and services they need.
Yeah, and it's not just the personal fulfillment and the social connection piece of it, it's even access to healthcare, because we know telehealth became so very important during the pandemic to give people an opportunity to, connect with their doctor, see their physician virtually, across the internet, instead of having to go into an office where they might have been exposed to, COVID or other germs. And so making sure that people have access to have telehealth is really important.
Absolutely, yeah.
And then one thing I wanted to highlight as well was the expansion of the Supplemental Nutrition Assistance Program, also known as SNAP. And so it was a very small but significant increase, so from 135% of poverty to 200% of the poverty level, and that's $25,000 annually, which is not a lot. But for those individuals, being able to, if you were just over the poverty line and you didn't qualify, now you might be able to qualify. And as we talked about just a minute ago, the cost of groceries is going up so substantially, and making sure that seniors have access to nutritious food. This was a really important, again, a small increase, but really significant for those who might rely on that benefit just to keep food on the table.
Very important to those people who are the beneficiaries of that.
Yeah. But we also know that there's a lot of unfinished business as well.
So what are we looking forward to, and what are we still working on?
Sure. Well, as you may know, the legislature did not act on a historic $7 billion surplus that they had. I think that surplus has now increased to $12 billion, but so have the needs of Minnesota's older adults. And so one of the things we were really focused on during the 2022 session that we will be working on again is our long-term care and support services. So really addressing the long-term care workforce shortage, knowing that we need workers who can take care of our loved ones when they're no longer able to do so on their own. We need to do that through better wages, better benefits. We know that oftentimes those individuals, again, those frontline workers who were taking care of elderly, very vulnerable populations, they may not have had sick pay. And so they were forced to choose between going to work sick and endangering the health and safety of those that they were caring for, or getting a paycheck. And we feel that that's just not right. We need to make sure that their wages are competitive so that people want to continue to go into that line of work. And they need to be able to have ways to save for retirement. We know that a number of folks in Minnesota don't have a workplace retirement savings option, and so we feel that those wages and benefits, paid sick time, and ways to save for retirement are really important, particularly for that group of long-term care workforce folks.
Yes, the long-term care workers cannot be left out of the equation to stabilize the services that they provide to their clients, and to be able to earn a living and have benefits out of the career that they've chosen. So
absolutely.
Very important.
Yeah. Now the other piece of that is providing support for family caregivers. Now when we say family caregivers, it can be a spouse, it can be a child, it can be maybe a neighbor who, if you're aging by yourself, if you've lost your spouse and you never had kids, or your kids have moved away, it might be a neighbor or a cousin or a friend who is helping to provide that unpaid care. In Minnesota, we have about 640,000 what we call family caregivers, but they truly are unpaid caregivers who are, putting out this unpaid care in the amount of about $7 billion every year. And so being able to provide support for those caregivers, whether it's the ability to take time off of work and not have to worry about losing their job, or tax credits, those kinds of things. This is a really critical piece. Family caregivers really are the backbone to our long-term care delivery service here in Minnesota. And so getting support for family caregivers
a
is
lot
just
of times
crucial.
the family caregivers have to give up their jobs, give up their careers in order to look after their family members or their loved ones.
Yep, they do.
So this is a really important area for AARP to be focused on.
Absolutely. So the other thing that didn't get done, we talked about Social Security and how important that is. We heard from our members that, Minnesota is still one of 12 states that still continues to tax Social Security benefits through the income tax system. And so the tax conferees, AARP had supported a more balanced approach, making sure that low and middle income Social Security beneficiaries found some relief. Right now, it's a very complex subtraction formula to reduce a certain portion of your Social Security benefits from your taxes. We wanted to simplify that, make it easier for taxpayers to understand. But we also know that income taxes provide funding for many of those services that seniors rely on. And so we really supported a very balanced approach to that. The Tax Conferee Committee went a little bit further and approved a full repeal of Social Security taxes for all Social Security beneficiaries. But of course, that didn't get across the finish line. And so that will be on our docket again in 2023, and also with what was passed with the Tax Conferee Committee's a number of property tax relief measures for homeowners and renters alike. And as we know, the cost of housing has increased substantially as well, and so some property tax relief will also be something that we'll be working on in 2023.
So those are the key issues that AARP Minnesota, the staff and the volunteers will be advocating for in St. Paul when the next legislature gets into session.
Yes, absolutely.
So
absolutely.
A really important mission that we have here, and the more volunteers that you can get engaged to help get the message out and to be involved in advocating for these key issues would be very helpful. So as we wrap up the last few minutes of our program, anything else that you would like to share with our audience about AARP?
Yeah, of course. So these issues that are so critical to the 50 plus and their families, we wouldn't be able to get any of this done if we didn't have the backing of our volunteers and our activists. So I would really encourage anyone, if you have a particular passion around some of these issues, let us know. We'd love to have folks as an advocacy volunteer. And sometimes being an advocate doesn't mean you have to show up at the Capitol and meet personally with your lawmaker, although we do love it when folks do that. Sometimes just being able to send an email or make a phone call or write a letter to your member of the legislature is enough to show that this is an important issue that they should be working on and paying attention to. The other thing that I would say is that sharing those personal stories, right? Like, I can talk about this all day long, but I may not, even though I did turn 50 in the last year, I may not be necessarily the face that lawmakers would associate with some of these really important issues. And so hearing directly from the people that these policies impact, I think, is the most powerful thing that can really help change policy and make things happen, is when someone is willing to share their story about how they're directly impacted with their lawmakers. It just makes such a difference.
Well, it's really important work that AARP does on the advocacy level. But there are, for members and the public, there are social events that AARP sponsors. Aren't there a couple of those coming up here? In the near future?
Absolutely. We love to engage with our members locally, and we've done things like sponsored Jazz Fest. We have virtual Jazz Fest. We have movie screenings. Again, with the financial security piece, we have a scam jam coming up where folks can learn about how to protect themselves from scams and frauds, and just finding ways to have fun. We're looking at 2023 and finding all ways to get out in the great outdoors and stay active and stay healthy, and just get involved and connect with other AARP members in your community.
Well, it's great that we got through the COVID, or the worst part of it, and that we're able to get folks back together again in a personally and in an environment where we can socialize with one another, and that's great.
Yes.
It's terrific to have those kinds of events available.
Well, and that's one of my favorite things about this job, is being able to connect with our members and provide those opportunities to make our community stronger, whether it's through social connections or the advocacy work that we do.
Well, I hope that our viewers got the message today, and if they're interested in volunteering, there's information that we have on the screen where you can contact AARP Minnesota. Our guest has been Cathy McLeer, State Director for AARP Minnesota. Cathy, we thank you so much for joining us today. Thank you for your time and for the very, very important messages that you shared with us along the lines of what AARP does for the benefit, as we said earlier, of all of our citizenry, not just AARP members.
Yeah, well, we appreciate the opportunity to talk with your viewers.
Thanks for joining us, and thanks for watching us.